So what is nystagmus? It describes a movement that we have with our eyes. Sometimes it's a healthy movement and sometimes it's not. So when we move our head and we see our eyes rotate, that's the normal response. And sometimes when we're moving, or if like there's a train going by or you're watching something move by, our eyes will do a reflex where they'll move like that, but then they'll snap back to find the next spot. That can be super normal if the world's moving around and your eyes are following things and using the reflex. But sometimes we see it happen when we're still, and it shouldn't happen. And this is really helpful for us because it helps us find pathology, especially as it relates to either the peripheral vestibular system or relative to the central vestibular system. And there are different ways that we look at nystagmus that help us to be able to differentiate between the two. Anytime we look at somebody that has a head injury or even an autonomic injury, we look hard to see if there is any nystagmus that's there that shouldn't be there. And that helps us realize how well that vestibular system is working. And that gives us a sense for how well somebody is interpreting where their head is in space, both when they're still and when they're moving.